And those original studies by the companies that make these devices showed that when you keep a patient in that range, they're asleep, they're less likely to have awareness. More recently, there's been a very large prospective study done at a university medical center, not sponsored by these companies, in which they did a prospective study of many thousand patients, half using these brainwave monitors and half not, half just using the typical, the older ways that we use of assessing anesthesia depth. And it turned out that there was no difference in the number of cases. In each group, it worked out to about 1 in 1,000 patients who had some recall of an event during the surgical procedure. Now, this was not all an unpleasant situation necessarily. Some of them were, some of them weren't. But the take-home message is that even that we thought we had a device that would tell us when a patient was having some awareness and would help us to deal with that issue, it looks now like it's not really all that helpful. So we have those devices, but it does not appear that they are going to be the great solution that it appeared they were.
You've brought some pictures, and if Phil, if you'll put the pictures up on the monitor, we'll get Dr. Delaney to tell us what they are. That's a lovely shot.
That's my overweight twin brother. No, that's me, actually. That's an operating room at Lynchburg General, room 1, as a matter of fact. I'm sitting there in front of the anesthesia machine. We have directly behind my shoulder is the gas delivery system with several vaporizers that we use to vaporize liquid anesthetics. To the left of that, we have the flow meters for oxygen and nitrous oxide and air. Above that, you can't see very well the actual traces, but that's our physiologic monitor with the EKG, the heart tracing, the oxygenation monitor, or the oximeter, which many folks have now heard of, blood pressure monitor. We also record temperature up there. And then there's one more monitor over to the left, which is our respiratory monitor, which gives us levels of carbon dioxide and our anesthetic gases. And if we're using the so-called awareness monitors, those would show up on that monitor on the left. You can see the hoses. The hoses were to the patient who was having a surgical procedure. This is a closer-up view of our physiologic monitoring. On the top is our EKG trace. The next one down is our oximeter or oxygenation trace. Below that is the patient's temperature, which is 36.7. That's a centigrade value. That would be roughly 98 degrees Fahrenheit. And then below that, you can see the blood pressure with the current reading and then the readings back into the recent past. This is our respiratory monitor. This is where we would have our intraoperative awareness monitor showing the level, as I mentioned, from 0 to 100. It would actually show a trace and give you a number. We also record our carbon dioxide and anesthesia gas levels. And on the left is a fabulous operating room nurse.
All operating nurses are fabulous nurses.
Amen.
Okay.
This is not me. This is a model, I believe, using, this is the BIS monitor. This is one of the proprietary awareness monitors that we've talked about. It's an integrated EEG monitor that's placed on the patient's forehead with 3 actual electrodes, 2 right on the forehead and 1 lateral to the eye. And then you can see on the left is the actual monitor screen showing the tracing and then giving you the numerical value. In this case, you can see the number is 97, which tells you, as you would suspect, that this person is wide awake. This is an operating room. I believe this is a generic slide from the internet somewhere, but this would be a typical operating room with the surgical nurse with all the equipment, the surgical lights, and then in the background you see a sterile drape up with the anesthesiologist and his monitors behind it.
Tell me, how important is it to the prevention of anesthesia awareness happening for you to have a good pre-surgical discussion with your patients?
It's very important because, as I mentioned earlier, some of the things that increase the likelihood of anesthesia awareness are patient issues. The medications that a patient takes regularly, the amount of drugs and alcohol that they take, other medical problems, whether they're on blood pressure medicine, the strength of their cardiovascular system, do they smoke or not? So there are all sorts of issues that are important to talk to a patient about. It's one of the many reasons why we take a pre-anesthesia interview very seriously.
What kinds of follow-up care should a patient have after they've had this experience?
If a patient has intraoperative awareness with recall, it depends on the severity. We obviously want to talk to patients who feel that they've had some awareness during anesthesia. We want to have an open-ended interview where we listen to the patient and let them tell us exactly what they think happened. We want to try to assess whether the memories involved are likely to be realistic memories, or were they perhaps dreaming, which actually also happens during anesthesia. It's not unusual as we roll patients to the recovery room, and I'm sure you heard it too, many times where a patient will wake up and say, "Oh my gosh, I just had the weirdest dream."
And you always say, "And so did I."
Yeah, so did I. So we want to try to identify, was this truly awareness? Are these events that we could verify actually happened? Is there a reasonable chance that this patient recalls actual events? If that is so, then we want to follow up. Now, I think we were probably going to get to post-traumatic stress disorder if we have time.
We don't.
But we don't.
We only have a minute.
Anyway, if a patient, the statistic is that roughly 10% of patients who have an unpleasant recall event, 10% of those will go on to post-traumatic stress disorder, which is a more serious and long-standing condition involving recurrent reliving of the experience, nightmares, anxiety, high arousal, difficulty sleeping, and many other things. Those patients need psychotherapy usually for an extended period of time, and that's very helpful for that.
But for the most part, this is a rare condition, and I would like to reassure our audience that if they're having surgery, this is not likely to happen to them.
Not likely to happen, but we would encourage people to discuss it with the anesthesiologist if that's a concern.
I am delighted to have had you on my show. I thank you so much, Dr. Delaney.
Thank you very much.
Maybe
it was
you could
great
come
to
back
be here.
again.
I would love to.
I hope you all have found this show tonight informative. Please keep watching. We have some good shows coming along. Daryl Laurent, the Lynchburg News in Advance columnist, will be my guest on our next show. Thank you very much for watching. Have a good evening. Good night.